Hi, I'm Dr. Nixon with Healing Peak Regenerative Medicine's Longevity Channel, and today we're going to talk about 4 things that you can do before you get regenerative injection therapy that will improve your outcomes and make sure that your body regenerates the tissue the way that those injections are intended to be used. There are definitely things that can contribute to poor outcomes. Not many physicians that I know of discuss that with their patients, and so it's really important to educate yourself and make sure that you are in good health before you get those injections, because prolotherapy and PRP are only as good as the medicine that your body is making. And so if you're not in good health and your immune system is not functioning well, then they're less likely to be effective for you. They're extremely effective treatments if the patient is in good health. And so the first thing I want to talk to you about is balancing your blood sugars. You definitely don't want to be a type 2 diabetic getting prolotherapy or PRP. 1, it can increase the risk of infection, and 2, it can make the injection less effective. And most people are paying for these injections out of pocket, and so you don't want to spend a lot of money on something that's not going to work. And so the best thing that you can do at least a month prior to getting your prolotherapy and your PRP or PRP is, balance your blood sugars. Start eating a whole foods diet, making sure that you're getting adequate macros, fats, proteins, carbohydrates from fruits or squash, vegetable carbohydrates are really going to be the best type of carbohydrate to balance those blood sugars. And you actually may find that your pain decreases just by doing that, which means, less injections. So let's say you have a pain, 7 out of 10, and then you start eating a very balanced blood sugar diet, your pain might go down to a 4. And what that means is you don't need as much PRP or you don't need as much prolotherapy, which is less expensive for you, right, over time. Not to mention, the injection will be more effective and you'll need less injections much later in your life because that joint and that immune system will be working. So step 1, before getting regenerative injection therapy, get your A1C checked. Make sure you are not pre-diabetic or type 2 diabetic. And 2, even if you aren't, make sure you're eating a really anti-inflammatory, well-balanced macronutrient diet so that you have really nice blood sugar charts, as in you're not spiking your blood sugar and dropping it and spiking it and dropping it. That is one of the main reasons people get type 2 diabetes. So that's the first thing you can do. And then the second thing you can do is also dietary. Remove food allergens and food sensitivities. If you have food allergens and food sensitivities, they're likely contributing to joint inflammation. They can contribute to arthritic pain. If there's arthritis in the joint, it can trigger the pain response. And so avoiding the food allergens and food sensitivities doesn't necessarily make the arthritis go away entirely, but it does stop the pain response from the arthritis, meaning you don't notice that the arthritis is there if you don't feel the pain, right? So avoiding food allergies and food sensitivities is another really important thing that you can do prior to getting prolotherapy and PRP, because it shuts down that chronic inflammatory response that the PRP and Prolo does, which means, again, less injections, more effective injections, which is excellent. And, obviously your doctor wants you to get good outcomes, but I don't think a lot of medical doctors that are practicing platelet rich plasma have a holistic approach in doing them. And so that's why I really want people to know before they get it done things they can do to make sure that their outcomes are really good. And another thing you need to do is improve sleep hygiene, improve sleep. Obviously, if you're in pain and that's what's waking you up and that's why you're getting these injections, that can be difficult. But at the same time, if there are things that you can do, as in making your room completely dark, having a good bedtime, pre-bedtime regimen, brush your teeth, your body kind of winds down, shut the screens off at least 2 hours prior to going to bed, and have a wind down process so that you can get healthier, more restful sleep, more deep sleep through the night. That is going to also improve your immune response as well as your blood sugar response, which ultimately will mean less pain, less injections, and a better immune response when you do get prolotherapy and PRP done. So those are kind of the main things I just wanted to touch on. And then things that should be checked before you get prolotherapy and PRP are your cholesterol levels. If your fasting triglycerides are elevated, prolotherapy and PRP is likely going to flare that joint more. You may still get some effect, but you're probably going to get post-injection soreness that's could be significant and frustrating. So get your cholesterol levels checked. Make sure that your triglycerides are at a healthy and good level, and that you have healthy other fats there too, like high HDL levels, lower LDL levels. And the other thing that needs to be checked is your A1C and fasting insulin levels. The A1C is a 3-month average of your blood glucose levels. It's much better than a fasting glucose because that just gives us one day that you fasted. And, if you ate ice cream that night, it's going to be elevated. And if you ate broccoli and stopped eating at 8 o'clock, that's going to be totally different. And the A1C gives us a 3-month average, which is really, really great because then we can see what's been going on for that whole period of time. And if you've been having balanced blood sugars for that period of time. So, and then the last thing that really should be checked is a C-reactive protein quantitative, and you really want to make sure that's not elevated. Also, ferritin is a stored iron level, but sometimes can show inflammation. And if either of those are elevated, then you'll really want to work on your inflammatory issues prior to getting regenerative injection therapy, and there's a good chance you may not even need the regenerative injections after you reduce systemic inflammation. And it's a patient-by-patient basis. If you'd like to be assessed before you get prolotherapy or PRP, or are interested in getting prolotherapy or PRP injections, I would love to talk to you. Our phone number is 206-899-6000. Please like, subscribe, and share. If you know anyone who is going to get prolotherapy or going to get PRP, please share this video with them prior to them getting the injection because it may really help them get a better outcome. Thanks so much. Have a great day.